Okay guys, this is Dane. Welcome back to the channel Filipino Nurse Retires Home. How are you? And I hope everybody's doing great. And please comment, share, and subscribe to the channel if you have not done that yet. And I'm guilty in all counts, lazy, bored, and busy at the same time. But that's supposed to be not an excuse, okay? I'm gonna do my best. But this time I feel the need of talking to you. So let's talk about important thing. There's a lot of things that a foreigner or an OFW or Filipinos who has not lived in their country, Philippines, for the longest time and go back into the country. You have a lot of things that you have to consider before leaving. One is your pets. Okay, I'm gonna talk to you about pets later on. The house that you have. Now, with regards to the house, we're going to keep it for about 6 months, maybe 1 year. It all depends, especially that we have to consider about my daughter. She might need a house where she can stay for a little bit till she will be able to get her permanent job placement, okay? Now, I don't want to push anything also because I don't want the thought of having no house when I come back after 6 months in US, okay? Because the plan is actually sell the house and after that build a little house smaller than what we have right now. But of course, the market is so bad right now. Materials are sky high. So whatever you get from here is not gonna be enough to build a smaller house. Half of the size of this house would cost a lot of money, okay? So that's a decision that we're gonna have. Keep it for about 6 months. Now, another one that is the biggest one is the health insurance. Health insurance plays an important role before you retire, okay? Because your health is very important and not all of us are blessed with perfect health. And some of us are taking thousands of dollars worth of medication sometimes, okay guys? And I'm on 2 branded medication. I'm not gonna say I am perfect because I'm taking 2 branded medication to keep me alive. So I'm kidding around, but anyway, thanks goodness that my insurance right now will cover part of it. So when you decide for health insurance, you have to consider the cost because you live off a certain amount, okay, fixed amount because you're already retired. Now, with regards to us, we're gonna derive our income from pension, from my husband's work, 401ks for both of us, and Social Security. Now, I am already covered by Social Security because I am thankfully 63 years old and a half, and my husband is only 60. So he needs a bridge insurance in between 60 to 65 before the Medicare kicks in. While me, I'm only needing it for about 16 months actually, okay? By the time we need the insurance. Now, with regards to looking for a premium, it took me maybe about a year. I've been trying to search for something, very curious about everything. I go online and then plug in all your data there, and then the next minute is everybody's calling you. There's a lot of calls from different agencies calling you. But anyway, guys, that's why I found out that going online is not the good thing because they would not give you a good view of the quotation, okay? Sometimes they would not even give you quotations on how much premium you're going to pay. Now, we decided to talk with a broker, which is much advantageous because you can talk to her and explain to you and fill in your questions, the inquiries that you have and all your worries. So that was the best thing that we did, talk to a broker. And we found out that we can use the Obamacare, okay? But the Obamacare is based on the federal poverty line, which is for us, for both of us, we have to have about $68,000 income for them to subsidize so that we can be in both in that target for them to subsidize, the government to subsidize some of the part of the policy or the premium. Now, the only thing that we can control is the withdrawal from the 401k as well as the pension. Those we can go down, but the Social Security, I don't think we can, okay? So we have to really withdraw a little bit of money, just enough for us to thrive, okay? No extras. And that's only good there in the Philippines, 68,000, okay? Plus you have to pay premium, you know, and so on and so forth. For us, we can do that. However, I found out something. We can use COBRA also. It will be the same type of premium that we're paying now while my husband is working. It's gonna be about $1,287 a month, okay? So that would include all those branded medication that's already paid for. However, I found out something that is very, very necessary for you to find out, okay? If they have coverage on the travel outside United States. With this insurance we have, this is the Anthem, the platinum one. The Anthem, which is Blue Cross Blue Shields, they will cover the expenses, medical hospitalization in the Philippines or anywhere abroad. However, you just have to cough out the money up front, okay? So that's the biggest disadvantage, because you have to cough it out. But Philippines has very, the medical healthcare is very low. So maybe you can save some money and use that money for the upfront and then reimburse it by the insurance later on, online, you know? So you can be reimbursed. With the Obamacare, okay, with the kind of like 68,000 a year, we probably can get a platinum also that I feel comfortable with, or the gold, or even the silver. It's probably $800 a month. That's not including abroad. So I actually have to purchase a separate insurance that would cover us abroad. And that's about $407, and that's with Cigna Global. So if you're gonna add Obama plus the Obama, which is 800 plus, I already found that out, plus the 407, that's comparable with what we're paying for the COBRA already. So you have to consider all those things, guys. Another thing that you can also think about is you can also get you an international medical insurance, okay? It's gonna be lower if you're gonna be covered internationally. However, if you're gonna include US of A there, it's gonna jack up the price again. So I found that with a Cigna Global, they would cover me, for us, about 1,200 plus. So might as well get us the COBRA over all the other two. So that's what I asked my husband if he is agreeable to that. So guys, check with your COBRA. What if you get that coverage international travel, then you are gonna be okay. The brand names, guys, that's the one that kills you. If you can get generic medication that covers you, then you're gonna be okay. But sometimes generic medication sometimes would not agree with you, and you have to have branded medication. That's the one that really costs too much money. Because mine would cost, one medicine would cost about $900 a month. Holy cow. If you got blood pressure issue, if you got mental illness, oh Lord have mercy. Not even mental illness, just a little bit of emotional disorder, diabetes medications, my goodness, those cost too much money. So try to see if you can be covered with the COBRA, with the travel coverage, travel international coverage, then you're gonna be okay with that. Regarding your medications, okay, something I would suggest, if you're taking branded medications, like blood pressure medication, sometimes you're taking blood pressure medicine plus something to make you pee, or a diuretic. They combine that. So because they're branded, they're very, very expensive. So what you can do is get your primary care split that up to like blood pressure medication, and then the other one is for diuretic. So they prescribe that as a single medication. So it's much cheaper. Instead of paying hundreds of dollars, you only pay a copay of $10. So that makes a lot of difference. But there's a lot of medicines also out there that's branded and really specialty drugs. That's the one that kills you, you know, because they're kind of expensive, really expensive. So guys, I hope you'll be able to find the best insurance for you. So this is just something that I can share because I really been working on this for the past year. Okay guys, thank you, bye bye, God bless.